Just wait. So I'm Dr. Hannan. I'm one of the local GPs here at Thornley House. And today I've been asked to talk a little bit about COPD, smartphones and the internet. Now before I start, I just want to know, how many of you have got access to the internet at the moment?
Alison does mine.
So it's 1, 2, 3, 4, 5 people out of 10. So that's about 50% of the audience, which is really interesting for us to think about. How many of you have got a smartphone? One of these phones that allows you to access the internet. So out of about, just count up, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So out of 11, two people? So 2 people out of 11, that's like, what's that, 20%?
Yes,
Roughly, roughly about 20% of the audience that does this. I'm trying to imagine or guess what the youngest person is in this room, patience-wise. And I'm going to have a guess, without the camera looking at us all. But would it be fair to say around 55 or 45, 50 maybe, 55, 60? That sort of age group?
And the rest.
Yeah.
Age-wise.
Yeah.
And the rest.
And the rest. There's a lot more than that. So it's useful to think about the audience that we've got here today, and think about half the people in this room have got the internet, half haven't. But the thing that's all in common is everyone here has got COPD, chronic obstructive pulmonary disease. Yeah, everyone's nodding. Okay, so that's where we are at the moment. And what I want to do is just talk a little bit about what COPD means in terms of the internet and smartphones, what they can do, and maybe perhaps for those of you that have got it, look at what you're doing, and those that haven't, think about what you might be able to do by learning from some of the other people in this room. I'm going to start with this, because the question that you might all be wondering is, well, why do we need to bother? And I'm going to say because education is the most powerful weapon which you can use to change the world. Do you agree with that?
Yeah.
If only it would.
If only it would.
If only it would.
Do you not think it will?
I try my best, but I get met with an awful lot of blank faces.
From
Education, doctors, GPs.
Right. Okay. So the people that you think that you're going to, who should be helping you, just seem to go blank, and and is that partly because we feel as though we come across as though we kind of know it all, and why are you?
How dare you tell us something?
Yes.
We're a doctor. How dare you know something about something that we're not interested in?
Yeah, I'll tell you what to do. I'm the one that's going to give you the inhaler or refer you to this.
I'm the one with the pad, thank you, Paula.
Yeah. How do people feel about that? Is that?
No, I don't. No, I don't find that.
You don't find that? No, but do you recognise that that sort of behaviour does sometimes exist, and there are some people who don't seem to want to help patients, and instead say, I'll tell you what to do, and you come to me and fix me.
I always get satisfied with what you come for.
Yes,
I don't find that here at all. Everybody's very
No, this is general.
Yeah.
We're not talking about anyone in particular or any specifics. It can be different at different times. My own take on this is that there are times when it might be appropriate for a doctor or nurse to actually say, you really do need to do this and you need to listen, and please jump in, Natalie and Katrina, to see whether... I mean, do you agree that there are certain times when I think as a clinician it is important for us to say, actually the course of action that you're taking is potentially going to cause more problems, and this would be a better way of doing it. Pulmonary rehabilitation is a good example of that, actually, because most people don't particularly want to do exercises and don't like feeling tired and walking and things, and it can feel unpleasant. And patients don't want to hear that. They just say, just give me a pill that will fix me, doc, or an inhaler or whatever it is. And I'm sure your presentation here was talking about the challenges, but actually the more you push yourself, the better you get. There are, on the other hand, another group of people who go, I know it all and I don't want anyone else to tell me anything. And then there's a group in the middle. And it's the group in the middle that I want us to think about, where actually I can't fix you, you can't fix yourself, but together we might be able to do something. And that's why this is my picture over here of me in the consulting room with a patient of ours. And she might come along with whatever she comes along with a breathing problem or whatever it is. It could be a heart problem, chest problem or whatever. She doesn't know what's wrong with her. She's coming to the doctor to tell her what's in it. It could be the doctor, but it could be the nurse, it could be the pharmacist, it could be a specialist, could be a physio, whoever it is, it's that clinician, that person that represents the healthcare service. And you're coming along to say, these are my problems, these are some of the issues that I've got, these are some of the things that don't seem to be working right for me, can you help me? I'd like to be able to do. So if I just ask each of you, in terms of your own, what would you like to be able to do? We'll start with you, Ian. What's your goal? What are you hoping to try in terms of your breathing? What's important for you?
Well, I've achieved it.
Which is?
I'm better now than I was 15 years ago.
So your
when I
goal,
was discharged from hospital.
so your goal was to be better now
Yeah.
than 15 years ago. And if I ask you, what kinds of things is it that's better for you?
Because I learned how to deal with it.
Right, so you learn how to deal with
I
it.
got better medication.
Yeah,
Went on pulmonary rehab,
yeah,
and I'm still active
yeah.
in doing exercise.
And what kind of things has that allowed you to do that you perhaps wouldn't have been able to do 15 years ago?
Oh,
You
I've
haven't
just been sat in the chair and withered away.
Right, sat in the chair, withered
I
away.
probably wouldn't have been here now.
And I'm sure all of us would agree that we don't want to be sat in the chair withered away, and you definitely don't want, I wouldn't have been here. Okay, so that was for you, and you've achieved that goal, that's fantastic. What are you hoping to achieve?
Walk
Walk.
Yeah.
How,
without leaning on dustbins.
without leaning on dustbins.
Yeah.
So if you could walk down the street, so if you could just walk down the street without leaning on dustbins, then that would be an
That'd
achievement.
be alright, yeah.
Using a stick.
What about yourself?
I don't know, to help me to breathe better and
Yeah.
be more agile.
Yeah, okay. So
Yeah.
breathe better and become more agile.
Yeah,
What about
it's
yourself?
yeah,
What would you like to be able to do?
Yeah, but you know, as long as you can get a bit more quality of life.
Better what do you mean by better quality of life?
Well, able to get about better and not having to stop and having to have a puff of the puffer, and, you know what I mean, and all that. To
Okay.
me is more, you know.
What about yourself?
Yeah.
Keep motivated,
Yeah.
really, to keep doing lots of exercise and walking, not thinking.
If they don't exercise.
And what gets you in the morning when you wake up? What gets you up and think, I'm going to do this? Because there'll be times when you just don't feel motivated, you don't feel like doing
No.
anything.
Yeah.
What makes you get up and go?
If I don't do the lawn today, it'll be much harder to do tomorrow.
That's it, isn't it? That's a fantastic
Yeah.
goal. If I can't do the lawn today,
Yeah.
it'll be harder tomorrow. So that gets you up and
Force
says, I'm
yourself
going to do
it,
this.
yes, yeah.
Honestly, I'd like to be able to improve my mental health. I'm a carer. I spend an awful lot of time worrying about the person that I care for because they have a breathing problem, because they are very, very badly asthmatic. And I spend a lot of time doing, and then when I'm not actually physically doing, and then spending a lot of time worrying, and I'd like to not do anything anymore, don't misunderstand me, but I'd like to get it more, it's not getting it more appropriate, it's about getting the best that we can, and we're not in a very good place at the moment. So it's about trying to improve things for them so I can then improve things, and I can stop worrying. And it's probably very selfish, but that's what I'm trying to do.
No, that's lovely to hear. And I don't know if you all heard, but she kept saying we. It wasn't really very much about I, it was about doing things together and seeing what we can do. And it is very much about the we. The more we start thinking about the we and what can we do together, the better it's going to be. And I'm going to come back to that in a moment. What about yourself?
Well, I'm really chuffed because I've stopped smoking. So
Hey, well done!
since I came to see you, and I'm that fed up of being poorly, that was enough. And when I came to see you the last time, I thought, and you said to me, Norma, you know what you need to do, and I thought, that
Stop
is
smoking.
it. Stop. And I've been
What benefits have you had having since?
a lot, much better. And not just me, I think about my family. I love my family. We've got a new baby coming again, so it's going to be another granddad again this year. So I'd like to be here to still see all my grandchildren. There's a big fair coming up, so they're all coming up and we're all going on that. My breathing's been a lot better. Like I said earlier on, we like to dance, so at weekend we go out. I could only probably have one dance, come back and I'd have to take me inhaler. Now, we had 6 or 7 dances.
Wow.
And I didn't even have to take me inhaler. And I found that the couple that we go out with, now they smoke, so obviously they have to go outside. They come back and I just go, and I think, God, I must have smelled like that. So I'm really chuffed. Plus I can get up the stairs without taking me inhaler. And like I said, all my family, because none of them smoke, and they've all said, Mum, you should have done it years ago.
So just listening to her, what were the things that she's come out with that were goals for her that she's achieved?
Stopping smoking.
Stopping smoking. What else has she been able to do?
Dance more.
Dance
Yeah.
more.
Yeah.
Enjoy
Walk
life.
upstairs.
Enjoy life. Go up the stairs.
Stop smelling.
Stop smelling.
That was the worst part.
Isn't that amazing? Isn't that just
You don't
incredible?
realise you smell.
And you talk about family. Being
Yeah.
able to enjoy
No,
your
I love your
grandchildren.
family, yeah.
And do you see how just by listening, she's actually giving us lots and lots of reasons for why. What about yourself?
Well, I've just come today because I want to be a little bit more educated on. I was diagnosed with it about 12 months ago, and they said I've got a mild form of COPD, and I'm just one inhaler a day. I have a blue inhaler which I don't need, but I still feel at times that I do get out of breath, and there's times I do need. And I just thought to find out a bit more about it.
Right, so for you, it was the goal was really just to find out, learn, back to this thing about education,
Yeah.
educate yourself more.
Yeah.
And why do you think that education is important? Because as you say, you've got mild COPD. Why is it relevant to
I
you?
don't know, it's always better to educate. I mean, I'm 72 years of age, I'm not going to live forever, I understand this. But it's nice to educate yourself and maybe help yourself, if at all possible.
Yeah. And coming back to the we thing, it's not just about yourself on your own, but actually we all benefit from that.
Exactly,
which
yeah.
is wonderful.
Yeah.
What about yourself?
Just walk up the hill that I live on.
To climb up just to walk up the hill that you live on?
I live on, yeah.
It's not Worthlow, is it?
No.
Not quite.
There. Near Mill Lane.
Oh, my leg.
Yeah.
There's a challenge, isn't
Yeah.
it? But actually,
Yeah. So,
you're right, it is a challenge, but the reality is every time you open the windows and look outside, there's that hill, and the thought for you to be able to climb up that hill and get to the top would be a real sense of achievement.
you've
wouldn't
not seen the air.
it? Oh, I know which hill you're talking about.
Just had to help down it.
What about yourself?
Well, I've only got mild, very mild. I mean, I keep myself fit, walk every day, go out every day, take the wife out every day, because she's got it all 10 times worse than I am. So I try to keep her active and keep myself active.
And isn't that lovely that you're actually saying that you're doing it, it benefits you, but it also benefits your wife as well, and helps each other, and that's incredibly powerful. As a GP, I've seen that the most powerful thing, if you like, is not your doctor, your nurse or whatever, but your family.
Well, I don't let her sit down and mope or anything like that. She's out and she's walking. When she gets tired, if we're going Ashton or Hyde, so right, sit down there, and I'll go and finish the shopping up, and I'll pick you up and come back. That's how we do it. And she just had a new kneecap in before Christmas, which took its toll, because she had problems with her oxygen levels when she had it done. And it took her a while to get over it. But now she's walking without a stick around the house, which is a good thing. She doesn't hit me as much with it now.
You gave away a bit.
She's a bit unsure when she's outside. It's a confidence thing, I think.
Yeah.
She's got it in her hand, and it's confident.
So there's a goal, isn't there? Something about confidence and
Yeah.
being able to do things and not becoming frightened and worried. What about yourself?
I'd like to do more than what I do because I'm always tired and falling asleep.
I'd like to do more than what you do.
So,
I want to do these things, I can't, I try and then after a bit I start getting tired so I go and sit down again.
what kind of thing would you like to be able to do? That you can't
Like
do?
gardening and housework.
Right, so gardening and housework. Nothing too strenuous, but something that allows you to be able to do that.
I can't get down easy though.
Now, if you look at that, each of you had an individual story, and I could not have ever imagined what that could have been. That's why the doctor can't fix you, the nurse can't fix you. Each of you has got some purpose, some reason for why you want to be able to do more. And the other thing is, you're all realising that you can't do it on your own. You're going to need help, whether it's a husband or whether it's a carer.
Yeah.
Or it's coming here to do, and the other thing is hopefully learning that it's not just about us fixing you, but going away and being able to do things. So, my talk started by saying who's on the internet and who's got smartphones and things. And what I thought I'd use as this session is to go beyond what we've already heard about, the benefits of pulmonary rehabilitation, stopping smoking, which are incredibly important, and then start thinking about, well, what about the internet? What about smartphones and what we can do? What I'm going to do is show you what's possible. Just before I do that, how many people in this room have actually got access to their records? got access to their records.
Alison's got mine.
So at the moment there's 4 people out of 11 in the room that have got access to their records. And I'm going to come back, well, in fact I'll tell you now that across the country it's less than 1 in 100. So we are in a very, very fortunate group, and notice how I didn't put my hands up, so I haven't got mine either. But we're in a very fortunate room at the moment because we've actually got a lot more people here, relatively speaking, than the rest of the country. But I'm going to show you what it is that the 4 people can do and what's possible today. So, a smartphone, it's just a normal phone, but it has what we call apps on there. You can open up the app, and this is what it looks like. And you put your user ID in, and that recognises who you are, and it's a unique number that's only assigned to you. Once you've registered for the service, you put the password in. When you put the password in, it means that your information remains secure and safe. As long as you don't tell anyone else what your password is, they can't access your records. So you put your password in, and when you click sign in, you come to this screen over here. And you can see there's appointments that you can book. There's the medical record, there's the personal health record. So if you're into walking and you want to see how many steps you've been walking, if you keep your mobile phone in your pocket, you don't have to do anything. It records how many steps you've walked. And if you're pottering about in the house, even though you might not be thinking you're doing very much exercise, but at the end of the day, when you look at how many steps you've walked, that gives you some information. And you might want to think about how you can perhaps push yourself a little bit further, or following pulmonary rehabilitation, how you might be able to do more. And then you can order repeat prescriptions. And I'm just going to show you some of those things. So let's have a go at booking an appointment online. And the great thing with doing it through a mobile phone or through the internet is that you can do it at any time, 24 hours a day, 7 days a week, from anywhere in the world. You don't have to wait until the surgery opens in order to be able to do this. And in our surgery, we've got a number of different types of appointments that you can book into. So you can book in for blood tests, you can book in for a GP consultation, telephone consultation with the GP. Did anyone know that you can do that, by the way?
Yeah.
Those of you that are online, yes, good. Home visits, I'm not sure what home visits is.
I didn't know that.
Okay, so that's news to me, so I've got to learn something as well. And then you can book a nurse appointment. But what we're going to do today is have a go at booking an appointment to speak to the doctor. And I did this last night, and when you click on that, you can choose which date. There's an appointment available for today. And there were 2 appointments available at 8 minutes past 3 and at 12 minutes past 3. These are telephone consultations, but you can just go ahead and say, yeah, I'd like to book that appointment there. And when you click on it, it asks, which mobile number would you like the doctor to call you back on? The one that's registered on the system, or a different number if you've got one. What the reason is, so it might be a chat about pulmonary rehabilitation, or stopping smoking, or wanting to walk more, or breathe better, or whatever it is. And you click book. And when you've done that, it puts a reminder on there, so you don't have to forget when your appointment is. Whenever you log into your phone, it's got a little reminder on there telling you what time the appointment is, who it's with. And then if you decide that you can't make that appointment, well, let's not just forget about it, because someone else might want to take that appointment instead. So you can hit the cancel button, and hey presto, that appointment's gone. So you can literally log in, log out, book in whenever you want, and come out. And it's important that if you're not going to take that appointment, that you cancel it so someone else can take it instead. Okay, well, what about ordering prescriptions online? So if we just click on plus, and that's repeat prescriptions plus, you come to this screen over here, and that shows all the repeat prescriptions that you're already on. You've got them in alphabetical order. There's a little information button next to each one, so often patients will say it's those pink tablets there or the red ones, and those doctors and nurses are all confused about which one it is that you're talking about. But if you click on the little information button, this one's salbutamol, and you want to know more about it, you click on the I button, then this information comes up. It tells you a little bit about that medication. In this case, it's the inhaler, how to use it, what the side effects might be, what you can try and do to try and prevent the side effects. And it's lots of useful information that you can just learn there and then and find out more about. So let's go ahead and order a repeat prescription. We tick the little box next to it to say that's the one that we want. You write down which pharmacy it is that you want the prescription to go to if you've chosen the pharmacy, or if you're going to come and collect at the surgery, which surgery you want to collect the prescription from. If you're ordering prescriptions early because you're going on holiday or whatever it might be, you can write something in there so the staff know why you've ordered early rather than just rejecting it. And you click the submit button. It says, can you confirm that that's what you want? So you've got an opportunity to just make sure you're getting only things that you need. And once you've done that, you can see a message on your app that says requested. Now the great thing about that is that message has now landed on our computer systems here at the surgery. When we finished our clinics, the doctors, and we've now got a pharmacist in the surgery as well, will see that request and will hit the issue button. That prescription will then go to the pharmacy. When you then log in, what you will see is a message that says accepted. And that means that the prescription's now gone to the pharmacy, so you can then just walk down to the pharmacy and come and collect your prescription without having to ring the surgery, find out what's happened, has it been received or not. Sometimes we might reject that message for whatever reason, perhaps because the doctor thinks you shouldn't be taking it, or perhaps there's something else that needs doing. But if you've seen rejected, then what are you going to do?
Well, but that's what.
Yeah, phone up the surgery and say, why is it being rejected? What do we need to do? And you can find out stuff. So this is a great way of finding out what's going on without having to keep ringing the surgery all the time. Okay, what about viewing your medical record? Well, if you click on View Medical Record, then this is what comes up, and you can see your problem list. So most people are not particularly interested in looking at their GP record. Why would they want to look at that? But you might be interested in what your nurse has said about you. You might be interested in what your doctor has said about you. Most people, do you know how much people can remember when they've gone to see their doctor or nurse? What percentage of what's been said they can remember?
So
Not a lot.
Not a
How
lot.
much? 50%? No. How much?
10%.
Yeah, it's 10%. It's only about 3 bits of information. So we might give lots and lots and lots of information, but we don't really retain very much of that. And of course, when you get home and your partner says, well, what happened when you went to see the nurse or the doctor? You can't remember what they've said. So now there's the opportunity for us to say, let's just go online and check. There might be forms that you've got to fill in. More and more of the benefits and things are asking, when were you diagnosed with this, and who did that, and have you had an ECG done, or whatever it might be, are you under the specialists? You can see the date at which you were diagnosed with whatever you were diagnosed with. And again, there's a little information button that tells you more about that condition if you want to know more. But if we click on Problem List, then you can see all the other parts of the record. So you can see medications, test results, documents, consultations, immunisations and allergies. And if we have a look at consultations, then I had a consultation with my test patient this morning, and you can see that there. So there's my name, you can see the consultation, and it was today. And if we click on that, then you can actually see what I've written down. And here it says the problem was it was COPD, and in the history, diagnosed with COPD, still smoking 20 cigarettes a day, has been thinking about stopping smoking, not yet referred himself to the smoking cessation clinic, keeps forgetting to order his repeat prescriptions, would love to be able to play with the grandchildren in the park and not get so tired, has spoken to the practice nurse and been advised about the benefits of pulmonary rehabilitation, will give him more energy, will be able to do more for himself by being able to walk more and become less dependent on others to do things for him. He knows this will make him feel less depressed and give him a purpose in life. Just bought a new smartphone and got himself an email address. Not really sure how it's going to help him though. And then in the comments, well, if I turn slow so you can slide down, in the comments I've written, his goal this year is to be able to walk for 15 minutes in the park without needing to stop. Strongly advised to stop smoking. He needs to book in with the smoking cessation clinic. This is the single most important thing he can do to make a difference for his health and also for that of his family. Why would him stopping smoking be important for his family?
Passive smoking.
Passive smoking? Any other reasons?
The state of his health.
It's what, sorry?
The state of his health.
State of his health, but why would it impact on the family's health as well? You're right about passive
he'd be
smoking.
able to do more things with his family than...
But no, well, why would his family benefit?
They wouldn't worry about it.
Well,
They wouldn't worry about it. What about them?
They wouldn't smell.
Well, they won't
smell.
like it, would they?
You'd have more money.
They'd have more money to spend on other things, you're right. What else? Well, the most important thing is that the grandchildren would look at their grandmum and granddad and say, well, they're not smoking, I'm not going to smoke as well. If they're seeing smokers in the house themselves and they think, well, they're doing it, I'll do it as well. So if you stop, you're setting an example. Remember, family are the most important people in your lives. If you set the example, they'll follow you through as well. So you stopping smoking is the best thing that you could have done for your grandchildren.
Kale was always said to me, Grandma, please stop smoking. I don't want to come and see you smoking.
There's the impact. That's the impact. And imagine what that happens for his children and grandchildren and all the rest of it. Okay, come along to the meeting today at the surgery. Remember, this was a consultation I had with my test patient this morning on improve your quality of life, breathe better, live longer, where he can learn more about pulmonary rehabilitation and ask questions. It's ask questions. It's not lecturing you. It's kind of let's learn together. He can learn about what he can do with his new smartphone and learn to order prescriptions with it, as well as remind himself about what we've talked about. See the practice nurse again to further support him, make the changes necessary and help stick to his plan. I couldn't do what I do without the massive help of Katrina. I mean, she's put on this whole event today, and she's been an absolute star in the practice and supporting our patients. I'm sure each and every one of you would agree that nurses have a very, very important role, especially around changing behaviours, managing things. And there are times when there are things that you might not want to talk to the busy doctor about, but you'd be happy to talk to the nurse about just because they've got a little bit more time. So she's critical in all that. And here's me writing in the notes how important she is in that. And then see the practice website and search for COPD care to learn more about what else you can do. Okay, well, let's go further than that. So let's have a look at test results. And when we look at test results, over here it says peak flows. Does everyone know what peak flows are? You've all done them and things? Yeah? So if you click on peak flows, this is what comes up. It draws a little graph that shows you what your peak flows have been like over a period of time. And you can also see the actual results themselves. And it also highlights when the results have been abnormal. So you can see where the normal results are and the abnormal results. And the great thing is you can see that it dropped, but there's a visual description there of how things have improved. And you can start thinking, well, maybe at this point here, this patient stopped smoking, started going on pulmonary rehabilitation, and you can start to monitor how things have improved as a result of that. What else can we do? Well, let's have a look at medications rather. When you click on medications, you can see not just the repeat prescriptions, but you can also see any single item. So if we've just given you one antibiotic and you just want to check when was that last given, you can have a look at that there. You can also order your prescriptions from there as well. And of course, on this screen, you can see how much easier it is to see how to take the medications and when to take them and so on. And if we look at letters, so here's our letters documents section, and over here you'll see asthma management plan, because our nurses and doctors print into the records the management plan, and if you click on that, then you can actually see the document that they've given you. And it's there on your phone, so you're carrying it around with you everywhere you go, rather than being a piece of paper that gets put away in a drawer and then never to be seen again. It's much easier for you to be able to see and remind yourself of what's been agreed. And then finally, we've also got the option of being able to share your record. And what does that mean? Well, if you click on share your record, you can choose which parts of the record you want to share. So if you went to casualty, if you came to the pulmonary rehab course and there were questions being asked about how your COPD is going or what's going on in your health, and you were personally happy to share that information with the person in front of you, you could tick those boxes, click the I accept the terms and conditions, and then share the record. And the way you share the record is it creates something called a QR code, and if they've got a smartphone, they can then scan that, and the record literally jumps across from your phone into their phone, or potentially send an email if that was appropriate. But this is a way of you being able to control who looks at your record. It's not the world and everybody else, but it's that person in front of you. And you've even got the option to switch off the sharing once you've shared it, so that that can't be then passed on to anybody else at all. Okay, so that's a very quick run through on what we can do with mobile phones, and if you haven't got one of these smartphones, you can also do the same on the internet. But how do patients find out what they can do for themselves, and how can they learn more about COPD? Well, this is our practice website, htmc.co.uk. It's got a little search engine in there, and if you type in COPD into the search engine and click search, you'll come up with this link here, and if you click on that, you'll come to this page over here. And this has been designed specifically for patients with chronic obstructive pulmonary disease, so that you can find out more that's relevant to yourself. So you've got a link there to NHS Choices, which is the NHS website where you can find out information. You've got patient.co.uk, you've got the British Lung Foundation that Ian's a board member of, and what their COPD pathway is. You can watch a video, so if you're into watching videos rather than reading, you can just click on that and you can find out more. I can live with COPD, using the power of laughter to make a difference in COPD. So there's a little video that you can watch about laughter. And these are things that you could learn about yourself, you could share with other people, you could bring it along, you can come along to the Easy Breathe local support group and say, hey, listen, I've watched this, and does anyone else want to try that? And there's various other links there. There's even a little graph here which just shows the different types of treatments at different levels of COPD. We heard about at-risk, symptomatic exacerbations or respiratory failure. I guess it's mild, moderate or severe would be another way of looking at it. And you can see there that smoking cessation, stopping smoking, everyone can benefit from. Disease management really starts once you've been diagnosed with COPD. And pulmonary rehab can be started right when you've been diagnosed with it, but it increasingly becomes more important as you develop the condition. And in fact, even with severe respiratory problems, you can still benefit from pulmonary rehab, as I'm sure Ian's mentioned as well. So, just an overview. These are the different screenshots of what the app looks like, so that you can see what it looks like, and you can see pictures of graphs, results, consultations, and so on. Recently, a new app has just been launched. It used to be Patient Access, and the second one now called Evergreen. Similar kind of thing, but it's got slightly different colours. They're into wellness more, and they're going to be developing a whole load of things around wellness, so it's not just looking at the disease, but thinking about how you live with the condition. That has been launched for EMIS practices, including ourselves, and TPP and vision practices will be starting very soon, in the next few weeks. So. And finally, in the practice, we've been promoting the online services now for over 12 years, and this is our latest data. This was from Sunday. Overall, out of 12,032 patients, 6,929 of our patients have got access to their records. This is the age group from 0 to 100. Our oldest patient is 103 years old. You can see that there's quite a large number of people now in their 50s, 60s and 70s who are now signing up. But the other way of looking at this is, well, what about the actual patients? If you look at this, asthma, we've got 1,807 patients with asthma, and 1,183, or 65% of them, have got the full access to the records. COPD, we've got 388 patients with COPD, and 214 of them, that's 55%, have got the full access. I'm interested in the 140, 160 or so who haven't, and to start to think about what we can do for them. And maybe that's a bit of a discussion that half the room in here has got this. It'd be interesting to hear about the half that haven't. Is this something that you would consider doing? And if you've got the right kind of help and support, would you want to go along and be able to do some of these things? Cancer, scary diagnosis, but look at that. Out of 334 patients, 196 of them have got access. Someone talked about depression and the fact that when you have COPD, it does make you feel down and depressed. Well, look at that. Out of 1,594 patients with anxiety and depression, 1,565, 98% of our patients with anxiety and depression. I am absolutely certain that's because patients are wanting to know what's going on. They're wanting to be part of their care, this partnership of trust where we're working together on the same page. That's just phenomenal. There's only about 30 patients left and then we've got them all. Rheumatoid arthritis, heart disease, pregnancy, learning disability. Look at that. In the country, less than 1% of the population has got access to their records, but in our practice, 40% of our patients with learning disability have got access. They're not necessarily all doing it themselves. It might be that the carers are doing it for them. But look at how families are supporting each other. And then we've got Bengali patients. We've got 1,736 patients who are now ordering prescriptions online. Overall, it's 57%. And interestingly, last week, 27 patients signed up for the full service. So we are monitoring this and seeing it grow. So, final slide. What are the key messages for all patients with asthma or COPD? I think, as a doctor, the most important thing is for you to be able to understand what you have. It's not my diabetes, it's not my asthma, it's not my COPD, it's yours. And the more that you can understand about that, the better your chances are going to be to either prevent problems, to manage them, know when to call for help, and to seek help early rather than leaving it late. Always know where your rescue inhaler is. Please tell me that each and every one of you have got your inhaler with you.
I'm in my bag.
Everybody saying yes? Yeah? Fantastic, great, because you should always have your inhaler with you, even if you feel everything is absolutely fine. There is a lot of pollen out there. I have seen patients who've been absolutely fine, who've suddenly been hit by breathing problems because of the pollen out there. Know your care plan. Does everyone have a care plan? Put your hand up if you do. Okay, we fail. On camera, 1 out of 11. That's interesting. Only one of us does. So we need to do some more work there, I think, Katrina. Always remember to take your.
Plan have you got?
Always remember to take your inhalers and your medications with you. It's
When to take your medication and everything.
Oh, no.
well, Katrina, we'll talk about care
Can't
plans
get
when I finish.
Can't get into
Stop smoking. Is there anybody in the room that's still smoking? Okay, so we've got 4 people that have stopped smoking. We need to try and see what we can do to try and help you to stop. Go on a pulmonary rehab course? Who's been on a pulmonary rehab course? Okay, so 1 out of 11. So hopefully we're going to recruit all of you today and get you all signed up. Know who your nurse and doctor is. I think because this is a long-term condition, it's important that you try to latch on to one person. Now I appreciate that's difficult, and I know you've all tried to sort of say, I really want to see this doctor or this nurse. Being able to book appointments online might mean that you can choose who it is. I would suggest that it's probably best if you can latch on to one person. But I don't know what your feelings are about that, Katrina.
Familiarity is always helpful, isn't it? But sometimes it works both ways. Sometimes you get different angles from different people, so it can be it can work in different ways. But I think once you get used to a person, sometimes that's a good thing to.
Yeah.
The biggest problem with that, of course, is exacerbation. You need to see somebody as soon as possible.
Yeah.
Once you're on your emergency net.
Absolutely, and I think that's the thing, that when it's an exacerbation, you just need to see anybody.
Yeah.
But if you have someone who's keeping a long-term view on things, then that person can keep an eye on things and see how you're developing over the years and so on.
Yeah.
And I think that's really... When it's
They
an
know how you
exacerbation...
cope with it, that's why, because everybody's different.
Absolutely. And again, Breathe Easy are a fantastic resource.
He's on his knees, and we go, oh, you've got his importance with.
Yeah, and Breathe Easy are a fantastic resource to learn about, should I go and see anybody or should I go and try and see someone that I can keep an eye on. It doesn't have to be a specialist either. It's someone that you trust, that's the key. It's someone that you can have a relationship with. It's someone that you feel that you can actually work with, that's the key. Use the online services to drive your care. Never be fearful to ask. If there's one thing I plead to you, there's never such a thing as a silly question. You might think it's silly, but actually if we've not thought about it, tell us, because then it helps us to think about how things are. So don't be fearful about asking questions, and please sign up if you haven't done so already. We've got a PPG meeting this Thursday at 1:30 till 3:30, so any patients of ours, if you're free, please come along to the meeting. It's a fantastic group of people where you can tell them about today's meeting and raise a profile for COPD and asthma. And we've also got a dementia-friendly meeting at 3:30 straight after that. So if you want to become a dementia-friendly friend, that's for anybody, please come along at 3:30 and become dementia-friendly. Thank you very much.
Thank you.
Thank you.
Any questions on any of that for anybody?
Does that normally come up when the next PPG
Yes,
is?
it does. So
Where are being held?
when you, on the practice website, over there, underneath it says Horton Thornley Patient Participation Group. When you click on that, it will take you straight to this page here, which tells you when the next meeting is. You've got the agenda, you've got the latest minutes, and further down you can see everything else.
I used to get it from the email, but
now it's not. Now we're on Facebook. So we're going to promote things on Facebook. It's on there, on Twitter, but also if you just go onto the website.
Where's it being held, please? I
Here.
can't quite see here.
Yeah, it's in this room in there. Is that all right?
Thank you very much.
Thank you.